Justine here has something called Facet syndrome. And Facet syndrome, you can see right here, it's where the abdominals are weak. It's also called lower cross syndrome. And with lower cross syndrome, you have weak abdominals and weak glutes, among other areas. We did a great video on that, on lower cross syndrome, some great stretches and exercises. But it's also called Facet syndrome of the lumbosacral joint, aka lower cross syndrome. They're very, very similar. So we're going to put her on flexion distraction, on auto flexion distraction, to kind of open up that space right here in the lower back and correct some of that posture. And we're going to give her a little bit of heat and leave her on here for a couple of minutes, about 5 minutes.
One last thing. Tell me what you think in comments below. I went to film school before I got my doctorate. I do all the writing, directing, producing, sound, editing, and the cool special effects you see here. Folks, I'm not asking for an Academy Award or an Oscar, just a simple thumbs up if you like my video. And don't forget to subscribe to my channel for the latest, greatest content on YouTube. Thank you, appreciate all of you.
All right, 10 minutes of heat, and hello there, chunky monkey. Did you move all the way over there on your own? Huh? You helped her, you moved her a little closer? She's getting sleepy. Look, she's falling asleep almost. She's getting sleepy. All right. So after we put you on a little auto flexion distraction, I'm actually going to go there, in there with the hand and do it manually, okay? So you get a mixture. You get a mixture of Cox flexion distraction technique, which is this right here, what we're doing. And that helps with the Facet syndrome, the hyperextension here of your lumbosacral joint. And then we also put you on your side and we adjust you that way. Because both techniques are really effective for you. Do you have any lower back pain today? Good. So she's a couple weeks into her treatment. She doesn't have any lower back pain. Which, you know, back pain is the first thing to go away and the last symptom to come about. So when you have back pain, that means that condition that you're dealing with, you've had for a long time. It didn't just happen last night when you hurt your back, you know, when it started hurting. Again, those are the last symptoms to come about, and then the first to go away. So I think, what were you, pain-free in a couple of visits? So you can see here, look on this leg check. See how her right leg goes almost to her buttock, maybe a couple inches from her buttock. And this leg, look at the left. I'm pushing it as far as I can. Look at the difference here. Okay, see this leg here compared to this leg? Pushing it to the end. Big difference between this and that. So that's because of her pelvis. Her pelvis is out of alignment. And you're going to see right after I adjust her that that's going to even out and level out her legs. Okay, so we're going to start with your left side up. Good. And the other side up. Good. All right, let's check the legs now. And look at that. See that? Balanced. Perfect. Now, she needs to stretch the front of her thighs better, and I've told her that. With lower cross syndrome, people have really tight quads, and the quads attach up onto the front of the pelvis, and they tilt your pelvis forward like this. So when it tilts the pelvis forward, your body feels like it's falling forward. So your brain says, whoa, and pulls you back, which causes hyperextension right across your lower back. Lower cross syndrome. That's what she's dealing with here. So we're going to go ahead and reinforce that sacral adjustment here. So we actually use 3 different techniques with her. This is a technique called Thompson technique. Okay, now let's see here. Look at that, it goes a little bit further, another ½ inch or so. But again, the rest, she needs to stretch the quads a little bit more. Hopefully she's working on that on her own, are you? Good. Okay. Let's have you turn over on your back. Look at that face. Adorable. Okay, tuck your chin. Deep breath in. Come on up, have a sit up. Alrighty. There we go, great. Okay, hands up in the air. Relax your arms. All right, you're all set. Okay. You roll over to your side. So that side. Yeah. All right. Now.